Hello, everybody. My name is Crystal Arroyo, and today we're going to be presenting Triage Nursing. I work in an emergency department, and this is a huge part of our job, so today I'm going to teach you about it. The teaching method and strategy that we're using today is going to be lecture and PowerPoint. We have 3 objectives for you guys to know by the end of this presentation. So it's going to be an overview of triage nursing, to describe the role of a triage nurse, and to describe and apply assigning an acuity level using an ESI scoring system. So we ask, what is triage? Well, triage is a tool that is utilized to categorize patients based on the severity of their injuries and by order in which multiple patients require care and monitoring. Triage originates from the French word trier, which is used to describe the processes of sorting and organization. The purpose of triage in the ED is to prioritize incoming patients and to identify those who cannot wait to be seen. Roles and responsibilities. First and foremost is prioritizing patient care. Prioritizing is usually the most important, but it is also the most difficult. It's difficult when there's a long wait and patients see other patients go in before them and they become upset. And it's hard to explain to them that there are different levels in the emergency department, and sometimes we send patients to the fast track area and this patient is waiting for main bed in the emergency room. And patients do become visibly upset, and some leave and some yell, and just prioritizing is a very huge step in triaging. The next is taking vital signs and assessing the patient. Now, the patient comes in the triage room, the first thing you're doing is taking vital signs and making that across the room assessment. How do they look? How do they present? The vital signs also do tell another story. They could be sitting there but have a heart rate of 190 or be in rapid AFib. We don't know. This is why it's important to assess the patient. Next, you're going to take patient medical history and personal information, and you're going to closely monitor the patient's condition if they are waiting in the waiting room. Another important role is working closely with other staff members. As a triage nurse, I'm working very closely with the charge nurse, going back and forth on who's priority, who needs a bed right away, and etc. Experience. Now, there is experience that comes with triage nursing that you have to have before you can even triage. So the first and foremost is you need 1 year experience in emergency nursing. It has to be in emergency nursing. You must complete additional training, so that is a 4-hour course of education on triage, and also 16 hours with a trained triage nurse by your side. And you must participate in ongoing professional education. This is all important because as a triage nurse, you're up front, you're the first person to see this patient, and you should be able to identify if it's critical, if it's an emergency, and be able to prioritize these patients appropriately. Skills required for triage. So this is why we need experience as an emergency room nurse in order to be in triage. Now, the first and foremost is time-sensitive decision-making. When a patient presents in your triage room, you need to know if there's something that's very time-sensitive, such as a stroke, an MI. If this patient is coming in saying, oh yeah, I have weakness, I have dizziness, my left arm feels numb, you know that those are signs of a stroke, and that's very time-sensitive, so you have to call that stroke immediately. And a provider will come up to the triage room and assess this patient and send them to CAT scan as appropriate. Next is interpersonal and communication skills. Communication is extremely important. You're communicating with registration, with the patient, with family members, with staff members, and you're also taking call-ins from other facilities that are sending their patients to be evaluated in the emergency room. Accuracy in identifying patient problems. Again, you have to know what the signs are for critical patients. Are they having an allergic reaction? Are they breaking out in hives? Are they having difficulty breathing. You got to be accurate. Critical thinking, as with any nursing skill, ability to establish emotional boundaries, and ability to cope with high stress work environment. That is extremely important. There's sometimes I have a 3 or 4 hour wait in the waiting room. There's 20 people waiting out there. There's people being upset. It does become very stressful, and you have to be able to handle that. Emergency Severity Index, which we also call an ESI level. Now, ESI levels is a 5-level triage algorithm that categorizes emergency department patients by evaluating patient acuity and resources. ESI level is basically just how we triage patients based on, is it urgent, which is level 1, to the least urgent, which is level 5. There are also 4 decision points. Number 1 would be, does this patient require immediate life-saving interventions? Number 2, is this a patient that can wait? Number 3, how many resources does this patient need? And number 4, what are the patient vital signs? So what is considered a resource? Now, this is important to know because this is how you're going to assign a patient an ESI level. So resources include labs, EKG, CAT scans, MRIs, ultrasounds, IV fluids, IV, IM, or nebulized medications, specialty consultations. So if you're coming in with OB problems and the doctor has to consult an OBGYN, etc. Simple procedure, which is like a laceration, repair, or placing a urinary catheter. And that's considered one resource. And then a complex procedure is like a procedural sedation, and that's considered 2 resources. And then not resources are history and physical, point of care testing, so like a glucometer, saline or heparin lock, oral meds, a tetanus shot, a phone call to the primary PCP, simple wound care, crutches, splints, slings, and prescription refills. How to determine the ESI level. So again, these levels range from 1 through 5, 1 being your most urgent and 5 being your least urgent. So level 1 is considered life-threatening, and some examples would be cardiac arrest, respiratory arrest, hypoxia with your O2 being less than 90%, unresponsiveness, overdoses, traumas, hypoglycemia with change in mental status, anaphylactic shock, and symptomatic chest pain. Level 2 is also very critical. They're high-risk situations. They're also the most interpreted as well. And these would be your septic patients, DKA, strokes, syncopes, altered mental status, suicidal patients, any patient in severe distress as well. Level 3 means a patient needs 2 or more resources. So this could be abdominal pains, flank pains, nausea and vomiting. All these patients will need labs, they will need urines, maybe even a CAT scan, an ultrasound, see if there's a kidney stone with that flank pain, and also IV fluids, IV meds to help control their symptoms. Level 4s need 1 resource. So this could be your back pain, your arm pains, your lacerations, cold-like symptoms such as sore throat, congestion. And then level 5s are no resources. So these are your just basic medication refills, or they're here for a pregnancy test. In the next few slides, we're going to do some practice cases so everyone can practice triaging. We are also going to go over the levels and what those specific scenarios would be considered as an acuity. For the first scenario, an ambulance presents to the emergency department with an 18-year-old female with a suspected medication overdose. Her college roommates found her lethargic and not acting right, so they called 911. The patient has a history of depression. On exam, you notice multiple superficial lacerations to both wrists. Her respiratory rate is 10 breaths per minute, and her O2 on room air is 86%. So this would be considered a level 1. It requires immediate life-saving intervention. The respiratory rate, her O2 sat, and the inability for her to protect her own airway calls for immediate intubation. For the next scenario, we have a healthy middle-aged man. He presents to the ED with his left hand wrapped in a bloody cloth. I was using my table saw and my hand slipped. I think I lost a couple of my fingertips. No past medical history, no medications, no allergies. Vital signs are within normal limits, and he rates his pain a 6 out of 10. So this scenario would be actually considered an ESI level 3. It requires 2 or more resources. Based on the patient's presentation, he will require at least IV pain medication and laceration repairs. In addition, he may need a radiograph, so an x-ray, and intravenous antibiotics. For our last scenario, we have, why the hell don't you just leave me alone? Yells a 73-year-old disheveled male who was brought to the ED by ambulance. He was found sitting on the curb drinking a bottle of vodka with blood oozing from a 4-centimeter forehead laceration. He is oriented to person, place, and time and has a GCS score of 14. So this will actually be considered an ESI level 2. It's a high-risk situation. The history of events is unclear. We don't know how the gentleman got the laceration on his forehead. Did he fall? Did he get hit? And because of his age, presentation, and the presence of alcohol, he is at risk for a number of complications.